Now, today is World Malaria Day. It is an international observance commemorated every year in recognition of global efforts to control malaria. Globally, 3.3 million people in 106 countries are at risk of malaria. In 2012, malaria caused an estimated 627,000 deaths, mostly among African children. According to the most recent World Malaria Report, death records reached 429,212 million new cases in 2015. The rate of new malaria cases fell by 21% between 2010 and 2015. Malaria death rates fell by 29% in the same period. In sub-Saharan Africa, spread and death rates fell by 21% and 31%. Advocates against the spread of the disease want more efforts made by governments to stem the spread. All right, joining me now virtually here in Lagos now is to discuss this day that is so important to health safety in tropical Africa is a public health director, National Medical Student Association, Temitayo Matthew. Tayo, it's good to have you join me right now.
All right, good afternoon.
Great. Now, malaria can be seen as one of the most popular diseases around sub-Saharan Africa or tropical Africa. Yet we still have the challenge of handling malaria, and we still record deaths from malaria despite the fact that it's been here with us for a very long time. Why is this so?
All right, thank you very much. I think in addressing that challenge, we might have to look at the root cause. I believe that for us to actually solve the malaria challenge, the malaria puzzle, we have to look at level of awareness, level of knowledge amongst the populace, especially those in rural communities who are more exposed to it. A lot of people attribute malaria to the wrong causes. A lot of people attribute malaria to fatigue. A lot of people attribute malaria to a lot more other things that is not exactly the cause, which is the bite of infected female anopheles mosquitoes. So once people start attributing malaria to the wrong causes, then they might in fact not be treating malaria and claim they are treating malaria. And that could lead to some other issues. We could lead to resistance to drugs, which is something else. But then even addressing the root cause, a lot of people, when they come down with malaria, some people still in this day and age prefer to seek divine help. So people prefer to take concussions, visit their herbalists, take herbs, which we are not saying that these are not effective, but then this is not 21st century practice. So in solving the malaria puzzle, really, I think that the biggest problem is in the level of knowledge, level of awareness, educational status, the level of knowledgeability of the Nigerian populace in addressing the root cause of malaria. So I really think that has a very strong role to play in the level of in the fact that we are still battling this disease today in this day and age, despite how long it has existed. And the next thing I want to talk about is of course, even why people have a role to play. People as well, the government, the government as well has a role to play. There are people in the country today who still do not have access to insecticide-treated nets. And in this day and age, if we say that we indeed want to end malaria for good, then we have to be looking at every population, especially the vulnerable population, having access to ITNs. Now, when ITN usage is not, it's not covering all at the moment, when we still have so many of our malaria interventions being funded by international donor agencies, then we probably need to do more as a country to ensure that yes, malaria preventive measures are upheld more within communities. So I would say number one, level of awareness, level of knowledge amongst people on the actual cause of malaria, which if they have the right level of knowledge, they are able to prevent it. Then number two, I would say that intervention, government intervention and support. We need to do better in that regard to ensure that the most vulnerable population receive the right assets to actually prevent themselves from this disease. So I would, I think that would be all from on that particular question.
Okay, now Tayo, the point there is, for those in sub-Saharan Africa, I would say that there's no family in sub-Saharan Africa that haven't had the experience of malaria. once or twice or so many times in their lives. So when we talk about the issue of level of awareness, is it awareness of not knowing what malaria is, or is the level of illiteracy from the perspective of what to do, or what kind of awareness do we still need to have when almost everybody has had the experience of malaria before?
All right, thank you very much. I'll pick it. I like the way you put it, that most people have had experience of malaria. Now, before we look at sub-Saharan Africa as a whole, I will use it from a local perspective. If you take a instance at the traditional traditional ancestry of the Yoruba people in Nigeria. Yoruba people they attribute malaria to several things. Say, for instance, stress. I mean, when somebody is stressed, when somebody is fatigued, it's taken to be malaria. It could also be attributed to, taking too much oil, too much palm oil, or working under the sun, working under the scorching hot sun. People take those things to cause malaria, which they call Iba. Now, at that point in time, people would come around and say that, yes, I've had an experience with malaria before, which in fact was not even malaria. So when people cannot, when the level of illiteracy is so high that people cannot even people cannot even attribute malaria to the very root cause of malaria, then that becomes a problem. So by the time we have attributed other things to malaria at that point in time, the people who think that working on that scorching hot sun would lead to malaria, those people would not be the ones who would pay attention to the stagnant pool of water in their surrounding, which is a very strong breeding ground for the female anopheles mosquito that indeed causes the malaria. So I think that while it appears as though, yes, we've had good experience, people have had good experience, good incidents of malaria, it might not have been in fact malaria itself. But with that said, when people are not coming to terms with the actual causative agents for the disease, it becomes a problem in addressing it, because people are, would I say they are fighting the wrong thing or something? But I don't know if that takes care of that. But we need to do better in ensuring that people have the right information, people have the right tools, because that's even another problem. Even when those who know that, yes, this is malaria, and when they do not have the right facilities, mosquito nets and all of those other advanced vector control strategies, when it's not available, how do they cope with these things? It takes somebody who knows. It takes somebody who is educated to do things like, there are people who do even have biases against using insecticide treated nets. That again is a problem. People have biases. Some people think that, yes, research studies have shown that there are people who believe that they would die if they sleep inside the net. It is a thing. There are people who collect these mosquito nets, and then instead of using it in their houses, they use it in their farms to cover their crops. These people obviously do not have enough knowledge, because if they do, they would know how to put this to good use. And we are talking about places, we don't even have to mention names, but these are places who indeed need these facilities to reduce the numbers. But instead, all right.
Thank you, Temitaya Matthew. I like the scenario you created there, and these are the real things that happen in our societies, really. Thank you very much for your insight.
Thank you, too.
Great.